My name is Dr. Denise Braithwaite. I'm the mother of 2 girls and 1 boy. I got pregnant when I was a working mom. I actually was a junior doctor working in Jamaica. My first child was actually born here in the Turks and Caicos Islands at the Grand Turk Hospital. I had an emergency C-section, but what they did was they put the baby on me shortly after delivery. So that was skin to skin, which actually is one of the steps in promoting breast letdown, milk letdown. And then afterwards, they allowed me to breastfeed as soon as possible. The breastfeeding was well. I do remember them telling me, even as a doctor, I see that bottle in your bag, make sure you don't use it, and I was conscious enough too, as well as not to bring formula into the mix. For all 3 children, I breastfed exclusively up to 5 months. I actually tried going up to 6 months because I definitely do know the benefits of it. It was a very enjoyable experience. It helped to reduce the flow of what we call the menses after birth. It actually brought about contractions, and I can actually feel my abdomen shrinking as a result each time that I breastfed. And it really was a good opportunity, I find, for bonding with the baby, and it was very relaxing. So I certainly enjoyed it. The challenges that I had as a working mom now when I went back out to work, because I applied for my leave and I also applied for some no-pay leave so that I could be at home as long as possible. When you're working and you're busy, if you don't have an environment where you can actually step away and have a relaxing environment where you can wash your hands, use your breast pump, store your breast milk with an ice bag in the back, if you don't have an environment for that, it really sorts of discourage you from doing it. So that was the challenge that I had, which was, having that environment while I was at work and busy, being able to pump the breast milk comfortably, storing it, and then taking it back home for me. So having that challenge, I then started to introduce formula, but I continued the breastfeeding for all 3 of them up to a year, but it was mixed with formula after 5 months.
When we talk about breastfeeding with most moms, there's a lot of benefits, but they also have their share of little concerns. I say little, I'm not a mom, but they may say that they feel discomfort, particularly during the first few feedings. Oh, there isn't a way to measure how much the baby is eating. The fact that they'll need to watch what they eat, medication use, caffeine, because the things that go into your body is transferred to the baby, and that newborns eat frequently. So keeping up with a feeding schedule is difficult. How did you bypass that? Give them some tips on how to overcome this and just keep going.
Yeah. Well, I do remember my experience with breastfeeding with my first child, very memorable. It does help when you have a lactation specialist or a nurse who can actually show you how to do the latching process, which is showing you the proper technique of putting the nipple and the whole areola area into the baby's mouth. If you don't do that properly, as what happened to me with my first baby, so even being a doctor, you still, have to practice that technique. So what I would suffer from initially was that the nipples would get sore and cracked. But what I did know to do is that to express some of the breast milk and put it around the nipple area, and that actually helped with the healing process. What I also realized, and again, experience is something else, the more you breastfeed, the nipples become less sensitive to the breastfeeding process. So it does get easier. The first thing that brings a little bit of anxiety is initially when you're breastfeeding, when you have that colostrum, the milk isn't flowing as much, and you tend to want to think mentally that the baby is not getting enough nutrition, but they actually are, because that first milk is very rich. One of the things I used to watch that was comforting as well is that after each breastfeeding in those early days, especially the first 2 to 3 months, all they do is feed, pass urine, pass feces. So if my baby was passing urine, passing feces, I'm okay, the baby is satisfied. So you do have to resist that temptation. There was also the temptation of wanting to give water. No, they don't need it. Again, once they breastfeed and they're satisfied, they will come off the breast. So there's no thing about only breastfeed for 15 minutes. No, you allow the baby to breastfeed, okay? When they're finished, they're finished. The breasts burp them and they're quite fine. Once they're passing urine, once they're passing the feces, they're doing well and they're satisfied. And I have big babies, so it was nutritionally satisfying for them. I think people stop because, one, it might get a little bit uncomfortable with the nipple. And if you see your nipples are sore, just speak to the nurse or come back in and ask them to show you, again, show me the technique of the latching on process. And that will really help. Using the breast milk around it, if you get soreness, that helps as well. Daddies. Now, daddies do need to help, because if it was like my 3 children, every 2 hours they were up and wanting to feed. They feed more often. So the expressing of the breast milk, and I would say, when daddy reached home from work, this is my time now to sleep and rest. The breast milk is in the fridge or on the counter. You take over. Okay? So the breast pump, it's a lifesaver.